Understanding the AI-intervened user interfaces of online health consultation platforms. Online health consultation, OHC, is a type of mobile healthcare services that patients can consult with registered physicians about their individual medical conditions via the internet. Artificial intelligence, AI, and automation are beginning to play more roles in OHC services, taking on more responsibilities such as collecting patients' medical information. It is unknown how the AI-intervened user interface influences patients' OHC experience and how future UI design can better facilitate AI interventions for the patients. Presence is a widely examined element in the online environment that it can be defined based on different perspectives. Trust has been studied extensively in many contexts where human is involved in any forms of interactions, whether facing a human or a computer system. However, very few studies have explored social presence and trust in the context of OHCs. This paper aims to investigate patient perceptions, i.e. social presence and trust, of OHC interfaces with a focus on AI interventions. To answer this question, we conducted an interview study and a comparative study. The purpose of the study 1 is to identify any design features of OHC interfaces that are viewed being able to influence patients' perceived social presence and trust of OHC platforms, with a focus on AI interventions. We asked participants to break down OHC interfaces into small units, i.e. design features, identify any design features that have been or will be intervened by AI, and link any design features to user perceptions. Based on the findings from the first study, we conducted study 2, testing one AI-intervened feature, which is collecting patients' health information, to empirically explore how different levels of AI intervention influenced perceived social presence and trust. It is worth mentioning that there were 3 levels of AI intervention were tested. In study 2, physician-system- and agent-based interfaces. Physician-based interface requires a human physician to interact with patients, asking about their current symptoms, past medical history, etc. In this way, OHC platforms is only a tool that links physicians and patients with human intelligence. System-based interface contains a text box that requires patients to input their health conditions as detailed as they prefer and submit their answers to the system in one go. Lastly, agent-based interface is recently developed to include a virtual agent as the physician, who asks patients fixed questions with certain levels of intelligence to distinguish whether a patient has responded to the questions properly. It is designed to reduce the cost of human physicians with some extent of AI. AI greatly intervenes in information architecture, information content, and functional interaction. Graphic design, information content, and functional interaction influence perceived social presence and trust. AI intervention at different levels significantly influenced user social presence and trust in relation to a specific UI design feature. Patient information collection. Results of this paper illustrated that agent-based interface was viewed as excellent as physician-based interface in terms of integrity and competence to win patients' trust. Participants expressed more willingness to depend on an agent-based interface compared to a physician-based interface on descriptive analysis, and system-based interface on significance analysis. These findings indicated that patients have accepted the new role OHC interface plays to some extent during health consultations.